Hi, I'm Dr. Rajat Gupta and I'm talking to you about how do you prepare for a buttock augmentation procedure. Now, buttock augmentation procedure is a procedure which involves transfer of fat, taking out fat from certain areas of your body and transferring into your buttocks where you want fat, and you have to discuss this with your surgeon and make your mind regarding the shape of the buttock. So that's the first thing which you have to decide while you go for a surgery. What shape of buttock you desire. Basically, this procedure is a whole body contouring procedure because you'll be taking out fat from certain areas of the body, from your waist, from your lower back, from your upper back, abdomen, wherever you have excess fat. Take that fat out and put that fat into the buttocks. This also helps you in achieving an hourglass shape. So, you have to plan what areas of your buttocks you want the fat to be grafted. Namely, you can have an increased projection of the buttocks. You can have increase in width of the buttocks. You may also want to improve the lower pole of the buttocks, which is sagging. You may also want to improve the lateral hip depression, or also called as hip dips. All these areas can be improved in every patient, or you may choose to choose any one of these. So you need to finalize and discuss this with your operating surgeon, what needs to be done in your case, depending upon what your requirements are and how you begin with before the surgery. The other thing what you need to be prepared is knowing about the recovery process. Now, if done properly, this is a very fast recovery process. That means you're up and about from the same day evening, you can move around, you can talk, you can walk, you can go to the loo yourself, you don't need any person to help you. From next day, you can do all your daily activities, but you do not have to apply pressure on your buttocks for at least next 2 weeks. You need to sleep prone, and while you sit, you need to use something called as BBL pillow. Now this pillow, what it does is, it transfers the weight while you sit of your whole body from the buttocks to the thighs. So your buttocks are offloaded of the weight. Now why this offloading is important? The reason is, if you put too much pressure on the fat which is grafted in the buttocks, it may absorb more. Now we already know that 30 to 40% of fat when we put in the buttocks gets absorbed. Whatever stays is permanent. But we want this 30-40% also to reduce, or it should not go more than that. So you have to make sure that you do not put pressure on the buttocks. Third thing is, you need to have a good compression garment made for yourself. Now what I prefer is a customized compression garment which gives pressure or compression on those areas where I have taken out the fat. But it has some holes, or it does not apply pressure on the areas where I have given the fat to the buttocks. So it is customized according to an individual shape after taking your appropriate measurements. So this is also very, very important. Other things you need to discuss with your doctor is, what are your comorbidities, you have any previous diseases, any previous surgeries you have had, and accordingly, your surgery has to be planned. I hope this video was helpful and I was able to tell you how to prepare for buttock augmentation procedure. If you have more questions, do write into us or contact my patient coordinators and they can connect you to me directly, and we will try to help you the best we can.